Now we turn to what's called a silent heart attack. Researchers are now saying that kind of event may be far more common and more deadly than anyone knew. Our medical correspondent, Dr. Jennifer Ashton, is here with the very latest on that. Good morning, Dr.
Good morning,
Ashton.
Julie.
All right, what is a silent heart attack, and do we know we're having one when we're having one?
Well, that's a scary thing. It's both silent and potentially deadly. It's the type of heart attack that doesn't typically present with chest pain and shortness of breath. So you as a patient might be unaware that you're having one, and it doesn't leave its signature on the EKG after the fact, so your doctor might not be able to tell that you've had one. That is all changing now because a recent study, even though it's a small one out of Duke University, is using an MRI technology, which has been around for a while, to actually get a picture of the damaged heart muscle. So we might be able to pick this up earlier.
Wow, that's amazing. So does it mean that this technology, which is not new, does it mean it's going to be used in this new way?
Well, for something to be considered a good screening test, it really needs to be cheap, it needs to be fast, and it needs to be easily accessible. MRI is really none of those things, but it is accurate. So I think the cardiologists are going to be looking more in the future as to how they're going to incorporate this and amongst what subset of patients.
Is it something right now that's so new that if I'm at home listening to this and I know, I'm at risk of heart disease, I can go into my doctor and say, I want this?
Probably not at this point. And again, if you're high risk, we already know you're high risk. The real utility possibly in the future will be for the intermediate risk people. That's the challenge for the doctors, to figure out how we're going to use this as a screening test. The challenge for the patient is to figure out how to reduce the things that put us at risk for heart disease. That's the key.
Define the people in the group who would be considered intermediary.
So you might have a family history of heart disease, you might be obese, you might be a smoker, high cholesterol, diabetic. If you have all of those things, we know you're in a very high risk group. So those people really don't need to be tested. It's more the intermediate group.
Dr. Jennifer Ashton, thanks so much.
You bet, Julie.